Hello, my name is Doug Beardsley, and I'm the Director of Johnson County Public Health. We understand that Ebola is currently a matter of international, national, and local concern, and I would like to take a moment of your time to let you know how we in Johnson County are preparing for the possibility of a case at the local level. First, let me assure you that at this time there is no indication that Johnson County or the state of Iowa are in any sort of immediate danger relating to Ebola. In fact, of the individuals who've been treated on U.S. soil for Ebola, the majority contracted the illness overseas, and the remaining two contracted the virus while providing care to a patient at a U.S. hospital. There have been no cases of Ebola spread by public contact with any of these individuals. Our partners at the Centers for Disease Control have addressed and continue to monitor the concerns related to healthcare worker exposure. Our healthcare partners in Johnson County are closely following these adjusted recommendations and continue to update and practice their infection control and screening procedures. You may also have heard that the U.S. has implemented new policies requiring all persons traveling from the affected regions of Africa into the United States to undergo health screenings at incoming airports and to be closely monitored by public health officials for a period of 21 days after arrival. Given the severity of the disease overseas, this is a cautious and practical procedure to ensure that any new infections are immediately identified in order to protect the public. In the event that any travelers that meet these criteria have a final destination in Johnson County, we will be following guidelines established by the Iowa Department of Public Health to closely monitor or quarantine these individuals throughout the incubation period. As you can see, we are continuing to work closely with state and federal officials, as well as local healthcare providers, to protect the health of and provide excellent care for the residents and visitors of Johnson County. I would also like to take a moment to address the internet rumors that have been circulating, claiming that cases of Ebola have been identified in areas where they have not. Unfortunately, many scams exist that are designed to bait someone into clicking a link based on false claims. This is nothing more than a tactic used to drive users toward an online destination that they may not normally visit. To get the most reliable and up-to-date information, please follow Johnson County Public Health on Facebook, visit our website, or seek information from a trusted news source or reliable health agencies. Additionally, you may have heard stories about schools or other organizations excluding the family members of people who've traveled to Africa, even when that travel was not to one of the 3 countries experiencing the Ebola outbreak. This is unfortunate and unnecessary. The family members are close contacts of someone who has traveled to Africa who did not visit Sierra Leone, Guinea, or Liberia, pose no risk of transmitting Ebola to others. If your organization has questions or concerns about this, I urge you to call Johnson County Public Health for information and guidance. Again, at this time, there is no cause for concern in Johnson County. Myself and the department's staff of dedicated public health professionals are working diligently to stay informed and prepared so that we can continue to protect the residents of Johnson County. Should the situation in Johnson County change, we will be providing public updates as soon as possible. Thank you.